We're looking at advocacy around oral health, and it's everyone's business. So, hey, it's integral to our core business.
As a speech pathologist, it's extremely important. We often think that food and drink causes aspiration pneumonias, but in fact it can be oral debris accumulating in the mouth from eating and drinking, going down the wrong way and into the chest and causing an aspiration pneumonia, which results in patients becoming sicker, increased length of stay, and also extended care, because they become so sick that they require assistance with most of their activities of daily living.
The integration of oral health in the area of intellectual disability is absolutely vital. So many people with intellectual disability have got very, very, very poor oral health outcomes compared to the general population. But unlike many in the general population, they need other people to help them to maintain their oral health and to access oral health services. Many are family caregivers, but many are disability support workers who are unregulated workers who at best may have a TAFE qualification and don't have specific expertise in health, let alone oral health. And so the expertise of nurses, speech pathologists, occupational therapists and psychologists as well, particularly for people with intellectual disability who have challenging behaviours around the provision of oral health, are absolutely critical, as well as of course, the dental health professionals.
It's very important because I am a researcher in primary health care, and bidirectional relationship between oral health and systemic general health is the evidence is there. So the oral health and general health just interrelate so much together. So it's very important.
I believe today, tomorrow, and every day, the only way forward to bring mouth back into body is integration, and I strongly believe in it, and I emphasize integration is the only way forward.
So oral health is an integral part of general health, and it's important to make sure that we look at patients from a holistic point of view. So health is not just oral health or mental health, or it's a subset of health. So if you want to deliver good quality care to patients and to consumers, it's important that we factor in oral health. There's a lot of evidence in scientific literature which shows the importance of oral health to systemic health and vice versa. For example, type 2 diabetes. So it's very important that we keep oral health in our radar and make sure that it's a priority to ensure that our patients get the best possible health care status.
It is really important aspect of oral health improvements and public health. And I'm actually I'm from public health background, which is actually integration as a core. The organized public health community efforts is actually core of our business. So it is really important to my profession and my organization.
It's very important to the Centre for Oral strategy because it's a key strategy for us to maintain health for population right across New South Wales. If we integrate oral health in all aspects of general health, then all those individuals that are vulnerable and disadvantaged are actually picked up.
I think now, given the increasing problem of the oral health among the people in, of course, the high-income countries, but in many of the low and middle-income countries, it's really important that how we develop some kind of integrated oral health care in the low and middle-income countries as well. Of course, the Ajay's team, what they have done is really great, but this evidence-based, what his team has done in Australia, that could be translated into the context in low and middle income countries where the resources are really, really scarce.